We begin the news at 10 as COVID-19 patients fill up Idaho hospitals. It's causing more concern for crisis standards of care, where hospitals turn down some people in need of medical help. Statewide, we're near record levels for total hospitalizations and patients in the ICU. Medical staff in all departments are feeling the weight of the pandemic. With a shortage in nurses, it's leading to longer hours and more shifts at the bedside. Our Tristan Lewis spoke with a local nurse who is sharing her experience over the past 18 months. Tristan, what's her perspective after treating these patients day after day?
Michelle Lithgow says she's exhausted. She's gone from working 12-hour days to working 16 to 19-hour days for most of the week. But it's also the misinformation about vaccines and being labeled a bully for encouraging others to get the shot that makes some days harder than others. Healthcare leaders around the Treasure Valley continue to plead to folks to get vaccinated because hospitals and beds are filling up and getting closer to crisis standard of care.
Individual humans would receive a score based on their severity of illness that determines whether or not they qualify for not admission to the intensive care unit, but a trial.
Nurses are feeling the effects and making similar pleas.
The fallout truly comes from not having nurses.
Michelle Lithgow has been working as an obstetric nurse in the Treasure Valley for 7 years. She says the lack of vaccinated people is putting a strain on an already exhausted nursing staff.
We have nurses that are getting sick from COVID too. When we get exposures, we're mandated to stay home until we know that we're healthy so that we don't unwittingly expose our coworkers, expose a patient.
Pre-COVID, she was working with 10 to 12 other nurses on a shift. But those shifts are rare, working 16 to 19 hours on most days.
As much as we want to be there and help everybody, it's not helpful for the long haul. We can't sustain that.
It's not only the exhaustion from the long shifts, it's exhausting for Lithgow to be treated like the enemy for encouraging vaccines.
I don't ever want to lose that friendship with people over that.
Being an OB nurse, she's been there for people on the best days of their lives, helping deliver newborns. She says it's troubling to see some of the same people turn their backs on her and other nurses.
I feel like it has really done an injustice to nursing that overall, because of this one thing, people are going to doubt the other medical advice that we give them that could lead to what we would consider a sentinel event or a death.
Lithgow has seen former nurses quit and retire early from the added pressures. She even admits she's had the same thoughts.
I took a 2-week break from work and truly contemplated leaving altogether.
But helping people is what she considers a privilege and her purpose.
Regardless of this unprecedented time, this is where I am meant to be.
As she continues to stay at the bedside, she only hopes unvaccinated people get information from healthcare professionals to make the best decision.
And hopefully with that, being able to repair the humanity that has been lost in our country.
And she adds she knows not everyone is eligible for the vaccine, but says that's why it's important for those who are to do so. She tells me it's important to her to reduce the risk of people getting infected or critically sick. Kim?
Tristan, I've never met Michelle, and I hope she doesn't get offended by me saying this, but she just looks exhausted.
She just got off of a 43-hour shift after 3 days.
Yeah, I mean, she just looks exhausted and just, quite frankly, kind of just looks put out from having to deal with it all. So we appreciate her coming forward, though, to give us some perspective from her point of view. Tristan, thank you.